Good morning. Okay, that was really lame. Good morning. Awesome. Okay. That was kind of our first trick of the day to get up here and to actually not fall off the edge. So I think we all mastered it. Thanks for joining us today for the evolution of nursing in a tech-enabled future. I'm Bonnie Clipper. I am a recovering CNO and the CEO of Innovation Advantage, as well as the founder of the Virtual Nursing Academy. Excited to be here today. Susan.
Thanks, Bonnie. Hi, everybody. I'm Susan Grant. I'm the Chief Clinical Officer for symplr, and I am I'm always going to be a CNO. I was a CNO for 30 years prior to joining symplr, so really happy to be here with y'all this morning.
Hey everyone, I am Tonychris Nnaka. I am the Associate Dean for Research at the University of North Texas Health Science Center. My background research is in digital therapeutics, and I was the lead for launching the first digital health innovation concentration for nurses at UNT Health. Good to be here.
Hi, everyone. Good morning. My name is Whitney Staub-Juergens. I'm the Chief Operating Officer at HCA Healthcare's Digital and AI Strategy. And I have not been a Chief Nursing Officer, but I'm happy to say I'm here representing nurses and nurse practitioners. I was an open heart and mechanical circulatory support nurse practitioner for multiple years and have had operations roles, both internal and external to HCA. Great to be with you.
Awesome. So we hope to give you some insights today and to be a little bit provocative around what's going on in technology and how that's impacting nursing. So there's a couple questions that we prepared, and then there are also some that have not been pre-prepared. So we're going to keep this interesting for you guys. I want to jump in, and I want you all to think a little bit about, with everything going on in terms of kind of a different psyche in the world. Patients have become a little bit more angry sometimes in their approach. Families have become more dynamic. Share your thoughts, I guess, in terms of how do we maintain a sense of empathy and compassion at the same time that we're really looking to adopt more technology and pressing more technology into nursing practice? How do we find a way to strike that balance, and what does that look like? Sure.
I think that's probably the biggest worry that I have around technology and the use of AI is how do we preserve compassion, and not only how do we preserve it, but how do we foster it and think about technology in that context of that it would enable compassion for nursing and our clinicians and enable the connections that we want to create with our patients. The other thing that I think is that I have a colleague who just shared, how when technology works well, they were describing ambient listening and how a nurse had a patient who was coming back from the OR and had to emergently go back, and they were using ambient listening. And the patient had asked prior to going to the OR, "Can you stop a moment and pray with me?" And the nurse stopped and did that and actually helped calm the patient prior to going back to the operating room. And when she went back to check her notes that the ambient listening had picked up, it talked about how the nurse had done this spiritual intervention to support and care for the patient. And those are things now that are not captured in our records or in documentation. And I think that technology can actually help us capture what nurses do best and foster that compassion.
And then, Bonnie, if I could offer, I think that technology can help us as nurses learn how to do that better. So I was an open heart nurse. I'm not particularly empathetic by nature. I'm not. Like, you ask my mother, she's like, "I don't know how this happened, that you're a nurse, but here you are." So you seem to be doing okay. The first time we used a large language model to generate a nurse handoff report, we then gave it a prompt, "Can you put this in a more empathetic lens?" And that was the first time it occurred to me, we can use technology in a really powerful way, because let's say fantastic nurse, you just don't come equipped with that. And those are the really hard, challenging situations for nurses that create a lot of stress in the care environment. because they might not be equipped to have those conversations with patients. But there's technology out there that can help us with that. We just have to get it into the workflow at the right time.
And I think just a few of the things that we have designed in healthcare system took away. It's not like we're not compassionate anymore, but I think the systems that have been created without nursing being part of that made it seem like we're not compassionate or empathetic anymore. Because you see nurses operating within the clinical system, and they have this large task of leaks and cognitive burden that they have to bear in addition to attending to the patients. What I'm hoping is that with the advent of technology, artificial intelligence, LLM, like you're talking about, nurses can be able to focus and do more what they are designed to do, right? The systems can help us summarize notes, highlight what needs to be done, and we focus on providing that care to the patient. I look back to during my time in critical care. It's a very high intensity environment. And what allows you to actually do the work and provide the care that you need to provide if the systems that you're working with are working for you. Currently, a lot of the systems that nurses work with are not designed for us. We've never been at the table. And hopefully, as we are advancing into this new era, nurses can be a co-designer of those systems so that we can actually focus and do what we're supposed to do.
I love that. Let's dig a little bit deeper into that one. So when we think about a technology-enabled future, what does that mean to us in nursing? What gets you the most excited? And what do you think we have to worry the most about?
You want to go for it? Go ahead.
Sure, I can take a crack at it. So I think I'm excited about what we don't know today that we're going to know tomorrow, and how fast we're learning as a profession. I've been in the digital and AI space at HCA Healthcare for 4 years, and it's completely changed in the last 4 years. So I think that's incredibly exciting. The intelligence that it can offer nursing. I hear all the time, we're going to practice at the top of our license. Great, but what does that mean, and how do we actually get the time back, and what does that look like? I think things that concern me are chasing technology and the change fatigue that comes with that. So, here's Bonnie said we can be controversial and put it out there, so I'm going to put it out there. As the chief operating officer for our digital and AI strategy, I am not about chasing technology. I think that technology is an enabler. It's what I'm there to do and make sure the team has what they need to be successful. But I'm not out chasing technology, because that's going to make it worse than it is today. My goal is to leave the healthcare industry better than when I found it. And if we're layering in ideas and we're layering in technologies for the sake of chasing technology, that is making the burden on frontline clinicians worse than it is today, not making it better.
So for me, I think what excites me the most is the fact that we've been thinking about technology, its implementation in clinical settings or across the health sector, as something that saves time, right? Or something that saves money. But to me, I feel like it empowers nurses more to do what we are supposed to do. The ability to think, the ability to create and create new ways of doing things. Oftentimes, nurses have been very burdened with the task-oriented thing within the clinical setting. We're often seen as individuals that just executes, and our innate training is to assess, diagnose, implement, evaluate, then repeat. We haven't done that effectively because the systems around us doesn't allow that more. So my hope is that as technology comes in and is co-designed with us, by us, we can go back to doing things that we are meant to do, things that we are taught at the very basic principles of our training. Now, to me, the thing that concerns me the most is that oftentimes we are thinking that with technology, nurses are not needed anymore. All these automations will come into place, then we're not needed. I don't think the healthcare system can function effectively without nursing. No matter how slick the technology is, without the human factor operating the system, it's not going to work. So I challenge every designers, nurses, biomedical engineers. When you're designing your system, don't think that it's going to automate and push the work out of the workflow system. Because when you do that, evidence has shown that 60 to 70% of solutions fail, not because they are not good. It's just they don't integrate into the workflow. So when you exclude the nurses out of the equation, then we're going to have an issue. So my concern is more of it replacing nurses, because that's what I'm hearing, but I don't think it would happen. And it's left for us nurses to make sure that we make that point each time we're engaging in these conversations.
So I'm going to add on to that because I think your point about nurses being involved in design is important. And I'm going to push the nurses in the audience to go one step further and be in the actual governance systems that are where those decisions are being made in the first place. So it's one thing to be involved in the design and to weigh in. And what does this mean for nursing? Get yourself at the governance table so that you can be there from the onset of those decisions.
So I want to push back a little bit on this whole notion that the solutions that are being created are actually being created for nurses. I think that's a crock of bull. You guys are creating stuff and selling it, trying to sell it through nurses to fix problems that are imaginary problems. So literally, I've had sit downstairs and had a couple conversations, and one was very interesting. It's a company that said, hey, we've just been acquired, and the CEO used ChatGPT to figure out what the problems were in nursing, and we've created a whole plan, and we're working to that. What the heck is wrong with that, right? So you got to live in our shoes. You got to figure out what the issues are, and you can't do that if you're not talking to nurses. So how many people in this room are a nurse? Raise your hand. Okay. So for you tech guys that are in here, find these nurses and talk to them about the solutions, because what happens is that it's the CNOs that are getting beat up after the organization is sold on an ROI and things aren't happening the way they're supposed to. And the CNO then is being held accountable. So I want to talk a little bit more about that. And I realize it's a little bit controversial and provocative, but that's where the real dirt is. So let's dig into that one.
So, and just building on your comment about talking to a nurse, find a nurse to talk to, that one conversation will not be enough. Nurses have to be embedded within your companies to talk and represent that clinical voice that's so critically needed right now in creating these technologies. When you asked us what we're excited about, I'm excited about nurse-enabled technology if nurses are driving it. And so you've got to be thinking about do you have nurses in your companies? Do you have clinicians in your companies who really do understand the workflows? Do you have advisory groups that can actually advise you on what you're developing and what you're creating? The other thing I would just say is that, I worry a lot that if we don't do that, we will never understand the impact on patient care that we need to understand to improve outcomes. Technology can help us do that, but you have to have the right people at the table.
Yeah, I mean, better yet, talk to the nurse and get to a hospital, get to a site of care, like go to where this actually happens so you can see the impact of that technology, as we're saying, on actual patient care and nurses.
Something I want to add to that is I feel like, nursing has been so underestimated for the longest time. And with all due respect to our peers in engineering, I work with biomedical engineers in designing solutions. And oftentimes they will have these structures and algorithm that it just looks perfect and fantastic. But the real reality of it, when technology is not meaningful, when technically you're looking at it, it makes sense. But when it doesn't integrate into the workflow system, nurses are not just seen as end user. And that's the case. Oftentimes nurses are seen as end users, not as a co-designers or as governance, like Whitney have said. So what I'm challenging the nurses in the room is not to wait for this industry to come to you, right? If you find solutions that you feel like you can implement design, find partners and start designing it. And hopefully the industry will pick up the traction. And I challenge the industries as well to, like my peers up here have said, seek out nurses who can better explain your solution. And oftentimes I've been in the rooms where we are explaining that this actually doesn't work, but it's not even taken into consideration. So another thing is us giving you feedback and you considering those feedback. So it goes both ways. If you are trying to design something that really, really can be implemented across the healthcare system, especially in the clinical setting, it is crucial that you have a nurse at the table, not just at the conceptualization phase, but throughout the whole process. Then go towards the governance, because that's an interesting point that you've brought. I teach the digital health innovation at my institution, and my students, that's something that I arm them with. I say, you have to pay attention at every single phase of innovation to make sure that you are not just redefining the blueprints, but you're setting this tone so that when it happens again in your absence, your voice will still be in that blueprint.
Yeah, I've weighed into lots of clinical solutions over the years, but and I'm captain's log day 46 on the job. So I'll let you know next year how it's going. But all that to say, as a nurse, I have a seat at the table to have a say in the portfolio in the first place, and am in a much better position to help our chief nurse executive advocate for nurses and allocate the chunk of investment to the nursing agenda that we need to.
Could I just add to that too? I think too, I said that I had been a chief nurse executive for 30 years prior to this. Last year was my first ViVE, and overwhelmed is an understatement. When I first came here, I had never been. And I was struck with the fact that everywhere I went, I heard about everybody talking about nursing, but there weren't any nurses. And so that has stuck with me. And I was thrilled when we were going to do this panel today and the focus that ViVE is having on nursing and nursing involvement. But at the same time, I would say as a nurse executive, I don't know how many CNOs are in the audience or from health systems. Think about, we do need to upskill ourselves. We need to learn that if we're going to be at the table, we have to be prepared to have the dialogue and to be able to translate what we're hearing, what we're saying, and so that we can meet IT and our vendors halfway at least, so that we are driving some of those solutions.
Yeah, and I think to build on what you all are saying is, I'll admit, I'm pissed. I'm pissed at so much of what I read. And if one more of you messages me on LinkedIn to look at your AI nurse, I'm going to have to punch you. There's no such thing. Nurse is a protected term. So learn what you're talking about, learn what you're building, learn what you're selling, learn what you're marketing to. And for us, what we're seeing is literally, we're seeing the nursing profession being dismantled from the outside. You're commoditizing what nurses do and trivializing us to the point that it's all task-based. It's not. It's far more complex. That's where I think we're all looking for partners. Partners that want to work with us, partners that want to understand what nursing brings to the table. And a lot of this is on us, right? We've not always done a good job of explaining how we add value. But there are companies even today that reduce us to an AI nurse or a chatbot. That's not nursing. So I think this really is the opportunity for you guys to think about, how do we help you help us make sure that we can do a better job providing care to the patients and demonstrating the impact of that as well. So I want to hear from you guys. When you're looking at adopting technologies, how else do we measure the impact of this? It cannot all be based on productivity and labor.
Amen.
Amen to that. I think we also have to look at the experience, obviously, of clinicians, and that I always think that the best news would be if a nurse said, this made my life easier and it helped me to spend more time with my patients and do what I show up to do every day. And if patients' experience changes in a positive way as a result of the technology.
Yeah, quick story about nurse handoff. So as we were developing nurse handoff, we've had to explain what handoff actually is 6 ways to Sunday to technologists, to operators, etc., and heard over and over again, well, it's just when nurses exchange report. No, it's not when nurses just exchange report. The nurse will go into the EHR and pull out a ton of information, because what they're really, yes, they're exchanging report, but what they're really doing that you don't understand is getting set up to deliver care for the next 12 hours. And they're starting to lay out the pieces of the chessboard. That's high strategic thinking. And as Bonnie referenced, that's really complex. So, pay attention to that. So, if you're wondering, well, why isn't the handoff solution being adopted? Because you miss the other 75% of what nurses are actually doing in that really critical time. And they don't have a lot of time to do it. So, the initial pass at, well, what is ROI for something like nurse handoff? Well, it should be more efficient. Efficient is not better. Efficient and effective, no, that will be better. So it's measuring that effective part. And I completely agree with the panelists. We're going to have to find new ways to measure that we haven't had before. If you free up cognitive space for nurses, what does that actually mean? How are you measuring that? How do you know that you have actually decluttered their day? Because the noise in those care environments is staggering. If you go, Tonychris, stand in the middle of a critical care unit, it's staggering the amount of cognitive burden that is on the healthcare industry.
Whitney, I was just going to add to something you said before I answered that question. I really think the society doesn't really understand what nurses do. And for someone who is in academic nursing, it pisses me off as well, because we are often seen as bedside, you change bedpans and AI nursing. Has anyone heard about AI physician? And maybe in other countries, but you dare not say that in the US because you cannot replicate the knowledge. Oftentimes, industries think they can replicate our knowledge. It is quite impossible. And us nurses in academia have not done our self-service to, show the grounding principles of our training. It is science-driven, it's theoretical-driven. We have our own epistemology that guides us. So AI cannot replicate nursing. However, AI, if designed correctly, alongside with nurses, could help us do what we are meant to do. I go back to when I was in clinical, right? We operate multiple pumps, patients on chronic kidney failure, they're on CRT. Felix doesn't come into the room to do that. I'm operating the system. And you go on the chart string, I'm a tech, I'm a nurse, I'm not a tech. An ICU nurse is managing that system day in, day out, recalibrating the system. During the COVID pandemic, nobody works into the unit. Philip goes on the phone and tells us what to do, and we fix the system for them. We make suggestions. They adjust those suggestions, but they never give us credit. So the thing that we constantly hear of people creating solutions that replaces nursing is an insult to the profession. And I challenge every single one in this room to never use those terms again. If you want to co-create with nurses, do it. There are academic systems, academic units that can partner with you. There are clinical individuals that have, our CNOs that have the clinical practice. Partner with them and create something that works for nurses. Answering to the impact question, I think we will find, I hope that 10 years from now, when nurses are looking back and saying, what is the impact of technology-enabled future? We're not just saying that it saved time or it gave us room to do X, Y, Z, or it brought more money to the organization. But that is allowing us to now stop, think, and recreate things that we are meant to do. We have a nursing process. We are constantly at an evaluation phase. We do things, we redesign it, we redo it again, and we keep improving. That's what nurses are meant to do. And hopefully, these technologies can allow us to actually do that and be a part in the healthcare system, not just in the innovation side. Nurses can do more than we are currently doing if we can just be relieved of the tasks that we do on a day-to-day basis.
Susan, he's fired up. Let's hear it.
Yeah, we're not happy down here.
So I think that, I agree with you when you were talking about how we need to educate. I think that, I do think that we've brought some of this on ourselves, and that it is on us to make sure that we, as I said earlier, that we become knowledgeable so that we can represent nursing at the table. I think that in terms of partnerships, I think that we need to meet. Their vendors can be great vendors and we can be great partners. We need to recognize that. We can't do it individually. And we do need to use our academic partners as well. We have opportunities to bring nursing students in to, we actually have someone right now at symplr, a DNP student who's working with us on creating value metrics for our products so that clinicians can understand the value, but they're informing what that is. I think also, I do think that when we talk about our new graduates as well, that we need to be thinking about, as we educate them on how not only to use technology, they know how to use it, but what are the right questions to ask when they're evaluating it, when it's presented to them, how to push back, how to ask all of the right questions. How does it impact the patient? How does it impact my workflow? I think those are critical questions, and it's not part of the education right now. I think nurses kind of are done to a lot when it comes to technology, instead of saying, no, I need to be an active participant in this conversation.
So let's pull that thread a little bit more. We know that we have a lot of young people in the pipeline learning, going to school to become a nurse. They're certainly much more familiar with technology, tech natives, yet there's also a balance because there's human beings in the question. So I see a lot of young new grads when I go into organizations, and they're very uncomfortable sitting on a bed, talking to a patient eyeball to eyeball, being incredibly empathetic and compassionate in that moment, but very comfortable with technology. How do we mitigate that? What are the competencies that we need to create in the pipeline to make sure that they can balance the high tech and the high touch? How do we do both?
I like your point about academic partnerships. I think that's really important. And we're in the midst of orchestrating the same, especially from a DNP perspective. That's a fantastic degree to be embedded in here and offering arms and legs. I go to testing too. Let's get that in the early curriculum for nursing. What does it mean to be part of an alpha test? What's your role in that? And how do you participate in measuring? What's a beta test? Why do we do that? What's your role in that? What's a proof of concept? What does that look like for nurses? So we have 3 innovation hubs at HCA Healthcare, and they're real life functioning hospitals that test technology, but that's where we're learning this human technology interface. So what's the change strategy that goes with that? What are the initial observations when a nurse has the technology in their hand for the first time? What were the questions they asked? Why did they ask them? What was the resistance? What was the adoption? What did that look like? We have to be paying attention to much more than the technology. But I love your point on academic partnerships.
I love the high tech, high touch element. I think you're right. The current generation, I'll use my nephews as an example. We're in the same room and they're texting each other as they just talk to one another. And they're like sitting a few feet away from each other. And that's the generation we live in. And I think that's where our academic partners really come in. And I'm not biased because I'm an academic, but I think we have a role to play. That's where simulation comes in, right? We ought to utilize at the highest level of simulation technology to condition our new grads to be able to function in this environment. Think about virtual care. Now, there are individuals that cognitively, they cannot interact with humans. That is okay. I chose critical care because I want my patient to be out and I'm managing them. And when they are good, they can move. So we have different phenotypes. So we have our now we have virtual reality, augmented reality. And my program, we have that. One of my colleagues is leading that, Dr. Wasbidi. And what we are doing is to provide an environment where these digital natives who prefer to text and not make eye contact to kind of experience what it's like and see the value. And they get graded on the scale. And then when it comes to being able to write the right questions, one of my students is in the room and he knows how tough I am grading when you cannot question the mechanism of action. If someone brings something to you and you just accept it at face value, that's an issue. So us as educators, before pushing into clinical, have to do an extensive work in preparing them. And currently what we're doing is not just training the students, but we're partnering with industries to create more of kind of replicating what an actual clinical setting or practices of care environment would look like and have those students function in that environment. I think there's so many things that can be done, but the only way we can attain that is if we blend both our practice arm, the academic arm, the research arm together, and then we can harness the full power of nursing.
Yeah, I think, it's called partnership for a reason, right? And I do think it's almost like a 3-legged stool with academic practice partnerships, your health systems and technology coming together to partner. It's not on all of the technology companies, right? It's not on just the schools, but I think about the health systems as well. There are things that we can do in our health systems to help our nurses and our clinicians, I think about physicians as well, to be better prepared and be better partners when they are approached with participating in selecting or driving or designing technology. And so I think those are critical pieces that we all have a role in. We have there's a colleague of mine who just was talking about recently that he actually is having their nursing staff go through technology and AI boot camp as one of their core competencies. To me, that's not embedded right now, right, in our health systems. It needs to be. It's one of the gaps that we need to be very intentional and deliberate around that.
Yeah, I'll put a plug in for responsible AI principles there, because I would venture to say, I didn't know what that was until I was in this role and working with our chief AI officer and learning more about that. But how do you prepare and equip nurses across the world to understand what those good AI practices look like, so they're aware and looking for those when technologies come their way?
So let's dig a little bit more into that, because I think it's a perfect segue. How do we begin to develop more trust in the tools from nurses that are going to be using them? What happens if a nurse is utilizing an AI tool and there's an error? Is it on the AI? Does the AI lose its license? Or is it the nurse that's in trouble and gets reported to the board? So how do we begin to identify not only much more responsible principles and disseminate that, but also how do we understand how this works and how this flows? How do we build confidence, and where does the buck stop?
Yeah. In one of my previous health systems, we actually were using some AI within the EMR that predicted deterioration on patients. And then it was kind of on all of us. We ended up having an event where we said, well, wait a minute, this index was there. Why didn't you use it? Well, it was turned on without the nursing staff knowing it, number one. But then number two, I don't think that we understood at the time how those algorithms, or how that AI algorithm was built, and what content was, informing it. And so it, just like any error, I think we have to talk about systems, and it can't be on one person. And I think it kind of goes back to what we've been talking about all along, is nurses have to be involved from the beginning, from the co-design of how we're actually using things, so that we really understand how it's impacting patient care.
I think that's a great plug for systems thinking too. So as a nurse, you can't, it's not just about knowing the endpoint of that technology. You've got to understand how that technology is being used in the broader system, how that system's interacting with other systems in the hospital, and how you're arriving at this conclusion. But in that instance, I think of transparency and how important that is. And I remember I was on shift one night as a nurse practitioner, and we had just implemented one of the acuity scores. And, I've got a rep coming to me saying, well, this patient's score is 98. That should probably narrow down which one I'm talking about, but 98. And I was like, well, to your point, didn't even know it was running on the patients in that unit. I'll walk into the patient's room. They're on ECMO. If you know anything about ECMO, there is nothing more you can do for a human being right now in 2026, to my knowledge, other than support their heart and lungs with ECMO. Of course, the warning score is high. I'd be worried if it wasn't. But what actions would you like me to take? Instant mistrust with that early warning system. Instant mistrust, because I didn't know it was on. Nonsensical use of that particular warning system. And I've got a rep in the middle of the unit asking me what I'm going to do about this number. Well, there is nothing more that I can humanly do for this patient at this current moment. So just a major learning opportunity for technology there.
I think the healthcare system has a critical role to play in this environment. And I'm so glad that even our governing body like ANA is paying attention to how technology can be infused in the clinical workflow. But we cannot hold nurses accountable. This is my concern, that we will integrate all these systems and just add to the burden of nurses. If we are creating all these fancy algorithms, where I was in critical care, we have our trauma triage. It calculates who is at risk, who needs to go to the OR, who is not going to make it, so we'll prioritize OR for other people. Oftentimes, the nursing at bedside is not doing that. We have the traumas that pay attention to it. So if we get to the point where we're having all these fancy tools and we are not reducing the cognitive burden of bedside nurses and it's just adding an additional alert system, that's going to be a problem. So I would challenge our clinical partners, our leaders, to make sure that the system is acknowledging that as well. Perhaps this could be a workflow that now integrates people to monitor those triggers so that those nurses at bedside doing millions of things are not asked to be doing that as well. And on the academic perspective, I think we are doing a fantastic job, at least at my institution, preparing nurses to be able to function in those environments, to advocate for themselves, to over-document in a way that they protect themselves, and then understand those systems. Because when you have something embedded in your EHR or electronic health system and you don't understand it, then you can't effectively use it. So as we evolve, my hope is that our academia will caught up so that students being graduated are understanding how to navigate a system where AI and automation is becoming the new thing.
Thank you for sharing that. As we have a few minutes left here, I want to get your thought. We're on this journey moving from the Flintstones to the Jetsons. So as you fast forward 10 years, what is your hope that we fix over the next several years to improve not only for patient care, also for nurses?
Time for nurses to do what they show up to do and to provide nursing care every day to their patients and to improve outcomes as a result of that.
So improving that, can I reduce nurses because now they've done what they've needed to faster?
No, I don't think that we can replace nurses with technology. The thing that technology and AI cannot do is provide the critical thinking, the observations, those subtle changes that only nurses can see when they're with a patient. We can't replace them.
Okay, so if that's in your pitch deck, take it out. Awesome point, thanks.
I think nursing educational value can never be replaced, ever be underestimated anymore. I think with AI, what you're going to see is nurses being more independent and autonomous to do their own thing. Nurses can, we have the aging population. Nursing can lead so many of that. They can have their own businesses where they provide care at home for individuals, not having to be constrained within the healthcare system. For some of us that chose to be at the bedside, they will focus on doing more what Susan just said, connecting with the participants or the patients. I say participants, I'm a researcher, sorry. Connecting with the patients and providing the care, the touch point, and the empathy and the compassionate care that we've been missing. So if we can automate those tools, not automate them so they can function independently, but automate it to the point that nurse actually has to sign off to make sure that they always have to be that human element. Our nurses can focus on doing what they are supposed to do.
Yeah, I'm going to stick with this concept of cognitive space because I agree. I want to know that we're going to get time back, but that it's going to be effective time back. And otherwise, we're going to be in the same place we're in 10 years from now than we are today because we layered in a bunch of things that don't make any sense. So, 10 years from now, I hope that nurses are saying this actually got easier and this job is sustainable because it's not sustainable right now. And I'm totally with you. It's hard to measure, but it just needs to get easier. And right now, that's one of the first things we ask nurses. Did this make your job easier? If it's a no, start again, try again, next solution.
All right, so we have 90 seconds left. So I'm going to have you all think about what's one word that you would use to sum up the environment that we're in and where we can go. And I'll tell you, my mind vacillates between pissed and hopeful.
Optimistic.
Awesome.
Transformative. I think transformative would be my word.
I'm in between this optimism and realism, and that is probably because that is my personality. I'm utterly optimistic about the future for nursing and really excited about it, but I'm enough of a realist to understand how much hard work it's going to take and how much partnership and collaboration it's going to take to get there.
So if you're looking for hugs, Whitney's probably not the person after this to give you a hug. So I just want to thank the panelists up here. We've really tried to be very authentic with you and give you a sense of what our world is like and where we see it going. There's tremendous opportunity. So thank you all very much for your time.